Welcome, everyone, to this weekly live radio show at KCOW 100.7 FM in lovely, warm coastal Brookings, Oregon. Thank you for tuning into this week's exciting and fun program of Doc and Jacques. I am Dr. Gigi, and I'm sitting alongside my co-host, San Francisco Jacques. Hello, Jacques.
Hello, Dr. Gigi, and good afternoon to our guest today and to all the loyal and new listeners out there. Welcome to the Doc and Jacques, a radio variety show where we are able to highlight women in our ladies' first edition of this, which is going to be, because we've got a high-powered gal here in the, if I still say gal, I'm not, lady. Them, should I just say them?
Nope, lady.
No, okay. We are always excited to point out women that have excelled in what they do best. Today is a sunny, bright, warm day here in Brookings. It was a little bit windy and chilly out by the sea.
It was pretty wavy out there. They waved.
Yeah, waves. Yeah, that's what they were all waving to us today. It is October 2nd, 2024, and it is National Custodian Day, so be kind to your custodian.
Right, and every day. And today is National Fried Scallops Day.
Fried Scallop Day, come on.
And do not forget, it's also National Produce Misting Day.
Now stop.
Yeah.
Produce. I thought you said earlier when you said missing. Like what am I missing on my produce? But it's misting.
Misting.
Like the little mister that goes on.
A little thunderstorm you hear sometimes.
Okay, only in America. Hey, I want to give a shout out to our sound engineers, Ray Simon and Tom Bozak, and they want to apologize about some live feed issues that came up last week. It just happens occasionally. It comes down. The Pikes, and they got to deal with it. They want to let you know that it's under control and that you will get the full version of last week's Doc and Jacques, where the doctor and I talked about women in medicine that had to be replaced by another one because of the live feed issue. But on the podcast, which will be out shortly, you will get the full unbroken original.
Right,
okay.
Except for, in addition to that, we also have a little bit of a repeat from last time's because it was so exceptional and we were not really sure that it will be.
Today's National Produce Misting Day. I mean, wow. That's
okay. Yeah.
It's an interesting mix for national holidays because of that glitch in the Matrix. Again, you can find out. You'll hear it all on next when the podcast comes out. Okay. All right, what do you got in interesting facts?
Well, the interesting facts are going to be interesting, except for let's do first our little shout-outs.
Oh, our little shout-out to those people that are listening.
Right.
Okay.
Brother John, your brother John and Patty.
Yeah. Hey, Patty, niece Kelly and Jimbo.
Janice. Hey, Janice.
Victoria, Dr. Sherry.
And Chris. Rebecca.
Dave Howland and Claire.
Lucas, Rika, Mama. Sam.
Jaden, Jared, Grant, and Vera. What's up?
Scarlett and Darwin. Annie
and John. Hey, Annie and John. Susie and Montana.
Montana and
Utah.
Gosh.
Mama. Hey, Mama, how are you? I hope everything is good in Zuns via Mexico. Zuns via Germany.
Richard and Nina.
Teresa, Michael, and all the others of you. Janice, that have just been so supportive of this show and have listened to us since the beginning. And we do appreciate you. Can't do it without you. Thank you so much. All right. So what do you got for us today, Doc?
So today, as we said kind of last week, we have women in medicine. It is shockingly shocking and yet interesting. So let me get the facts. About 180 years ago, so in 1848, Boston Female Medical College, labeled very fancily, opened its doors with 12 students and 2 instructors. The school was actually formed because the creator believed it unnatural for male physicians to attend to women during childbirth. So this school was basically a midwifery school.
Okay.
1 year later.
In 1849.
Yes.
Okay.
Elizabeth Blackwell became the first woman to receive a medical degree in the United States. She graduated from Geneva Medical College in New York.
I wonder if that's still there. I don't know.
Don't know. She was rejected by more than 10 schools for men. No schools for women existed at that point. And she refused a mentor's suggestion that she disguise herself as a man to actually gain
I mean,
admittance.
I would beat up that friend if I were her.
I know,
Hey,
right?
you
I
look like
guess
a
that
man.
was
Just dress up
done.
like a man. Come on. Okay.
She actually only was admitted to the New York's Medical College due to a misunderstanding. The male students that were asked if they would agree
admit,
to that,
yeah.
they said, yeah, sure. They thought it was a prank.
By
So,
Dr. Prankish.
Dr. Prankish.
Yeah, he was famous there.
1864.
1864. Wait a minute. 1864, 1 year before the Civil War ends. Okay, what happens then?
15 years later, Rebecca Lee Crumpler, became the first African-American woman to earn a medical degree in the U.S.
Wait a minute. Rebecca Lee Crump. Isn't there what is the name of the pastry company?
Sarah Lee.
Sarah. Okay, sorry. Sarah Lee Crumpets. All right.
Okay, so she graduated. At that time, nearly all medical schools barred all black students.
Oh, no, wait a minute. That's why. She was 1 year before it was the Civil War was over.
Yeah.
So they said, let's just open up the gates right now. And so she was the first black.
Well, she graduated, so she was there even before.
Right.
And out of 54,000 U.S. physicians, there were only 300 women, and none of them, of course, were African American.
Wow, 300 women. This has been the 1860s,
Yeah.
70s. Okay.
In 1873, so 25 years after the first woman received a medical degree,
Okay.
right?
Okay.
In the U.S., a Harvard Medical School professor stated that excessive education for women would leave them with monstrous brains and puny bodies.
That is the most disgusting thing I have ever. I mean, seriously, that is such a slight. He says, if women become doctors, leave them with just monstrous brains and puny bodies. They're going to get lazy being doctors because they want to, capitalize on all themselves.
That's true. Well, at the same time, another comment was made by somebody else, and that's what this guy, a man, said. Because medicine is allowing women to enter the field of medicine with its repulsive details, it would undermine men's refined
So this doctor
appreciation
says
of
that
them.
having women in medical school would undermine men's
Yeah.
refined appreciation of themselves.
No,
Of
the
women.
women.
No,
Yeah.
It's the same thing. It's mud on the face. It's horrible. I'm sorry. I apologize for all mankind. I seriously do. It's disgusting.
In 1893, so yet another 20 years later, Johns Hopkins University School of Medicine opened with a co-educational policy, meaning women and men, largely because the major part of financial support came from women donors.
Okay, I'm clapping because finally it's 1893. Johns Hopkins University in Baltimore says we're going to let our doors be open for women.
Both,
because a lot of wives and widows had a lot of money that they'd inherited or worked on and made their own fortune, and they were saying, we will only give you money if you allow women to come in.
Possibly. That was a little strong arming.
Well, that's good.
So 1947, another 50 years later, Gertie Corey became the first woman to win a Nobel Prize in physiology or medicine for her work on carbohydrate metabolism.
Okay, Gertie Corey, C-O-R-I, Dr. Corey, she becomes the first woman to win a Nobel Prize, okay, in physiology. Now, did you know that the guy that came up with knock-knock jokes,
What?
well, he won the Nobel Prize.
Nobel.
Get it? Okay,
Got it.
I didn't hear any laugh from the sound engineers. I don't think they got it. Okay.
Okay, now we're going to the 1970s. The number of women entering medical school begins to rise significantly.
Summer of Love was over in the 60s. Okay, why were women
The women's right movement.
That's correct.
Right.
Yeah, duh.
Women's lib.
For me. All right, what happens in 2007?
2007, Nancy Andrews becomes the first woman to lead a top 10 U.S. medical school, serving as the dean of
Harvard, Duke, or Yale?
Duke University
There
School
it
of
is.
Medicine.
Okay.
Yep.
I never saw the notes before. So 2007, the first woman becomes a dean of a big major school, top 10.
In
Cool.
2019,
That's just
just
5 years ago.
ago, women accounted for the majority of students for medical school, 50.5%.
Now it's 50, almost 52.
And now it's like 55. Almost.
Oh, is it 55? That
Yeah.
many? Okay, good for the women.
54.6.
Get out there and enroll in medical schools.
So now on the offset of that is that many women actually stop after several years of residency. After practicing, they actually stop. So they
Because,
make a lesser impact. There are less women in the medical field at that point,
Why?
that age group. Family.
Yeah,
They will have kids and then they stay home.
yeah.
Yeah.
I get it. One offsetting factor to this expanded presence is that many women physicians, go part-time,
Yeah.
or they leave after completing the
Right.
residency.
And so if you think about, so sometimes it's burnout, it's other things too.
Where did you practice your residency?
In
Is that Wax-
Louisiana.
Oh, what about Waxham?
Wexham, that was 13.
In England.
Yeah.
That was your third year?
Yeah, medical school. That was,
Spent 6 months in England,
Yeah.
London, at Wrexham Royal Hospital.
yes, it was.
Okay.
So very cool, right?
Yeah.
Except for we lose a lot of women. But you know what? In our first show that we had, we saw that women between 25 and 30, I think, make up 77% of the workforce, and after that it drops off. So even though they are having childbearing years, they have the children, they still work to get their counterparts, the men, through school.
Well, I understand the same trend is happening in law schools,
Yeah.
right?
True.
Now, law schools are up against a big thing with the AI coming in, because AI is able to take place and know all the brief facts and all the history
Yeah.
and all the law that
Yeah.
it takes. Doctors, you still interface with AI, right?
Yeah.
And it's what was your comment the other day? You said, well, the problem with the AI, it sends me 10 long paragraphs that then I have to review to break it down just for a few sentences, because it picks everything literally out of the ether and
Yeah,
throws it at you,
does that.
just in
or
case.
it when some requests of somebody needs to be addressed, and AI just addresses all as, yeah, you're right, I'll do everything you ask for, which is not good medicine many times. So that's my major impact.
Speaking of robots, what movie did we see last night?
Bad rope? No, what?
The Wild.
The wild bot.
Okay,
Robot.
The Wild Robot. It's a PG-rated animation that was actually pretty good. It's about
cute.
a robot that gets waylaid and lands in an alien world with nothing but animals,
Yep.
and has to learn the language and serve them as a good, diligent robot should. Okay, doctor, that is very interesting. You had your own trials and tribulations to becoming a doctor when you were told by the university you'd spent 20 years at doing research for them. You get earning yourself some patents along the way, and brought so much money into the school, and then they said, no, you're too old, you're a woman. Okay, all right.
That
So
wasn't
that's what
official,
we
but yeah,
think that is
that's
just
true.
completely.
That's how the world works.
Big joke. Okay, today, I don't have a prologue today.
I know.
Was I supposed to?
You said we don't have a lot because we not.
Shoot. Oh,
but you
man,
can.
I could have had such a reflective prologue today, because today we have a reflective, a wonderful woman here in the
A
studio.
repeat guest.
A repeat guest who's been
you.
here once before, and we told you we'd have you come in at least once every 6 months, so here you are. And you've been on my counterpart movie, Jacques Talks movie radio station down in the south of here in Crescent City. You've been on that show a couple times. And who we are talking about is none other than Jamie Daugherty. And Jamie Daugherty is the CEO of
Coastal Home Health and Hospice.
Coastal
Right,
Home Health.
Coastal.
So welcome. Again, hospice is something that both Gigi and I are intimately work with and have been with. I've gone through those processes of people in our lives that needed hospice. It was there for those people that were dying and transitioning into death. And I can't say or bow low enough how many good things have come out of hospice. It's
Yeah.
an incredible organization.
Very,
It's
very helpful.
Super helpful. Doc here signs a lot of death warrants, death certificates.
My
Sorry to be
gosh.
making light of the death, but you sign a lot of them, and then you've had loved ones in your care that have benefited and reaped the measure of full, lasting, end-of-life care that hospice has brought. So welcome to the Doc and Jacques, Jamie Daugherty.
Thank you. It's good to be here.
Yeah, good to see you
Thanks for
again.
coming in.
Thanks for coming in. And we
Making
will
the
do a
long
double date
trek.
again. So, hey, Mark, if you're out there listening, okay? We'll do a double date one of these days.
Okay, so Jamie, you're the CEO of Coastal
Health.
Home Health and Hospice.
Yes.
So,
Home
right?
health? I didn't know it was home health.
Yeah, it's
Coastal Home Health and Hospice in
okay.
Brookings
All
and
right.
Coastal Hospice in Del Norte County.
So you're serving
both of
both,
them.
running across
Yes,
borders
right.
all the time, right?
So even though Jackie here butchered it a little bit, why don't you say in one or two sentences what service you provide?
Well, we do home health services for Curry County, and then we do hospice for Curry County and Del Norte County. And then, of course, we have our durable medical equipment company here in Brookings, and it does delivery to both Curry County and Del Norte County. So,
Very cool. And so who gets you in touch? Who gets the patients in touch with you?
very frequently, the providers, your PCP, will send you over to us, or if you've had the unfortunate experience of being in the hospital, they'll send us your information too to continue nursing services at home.
Very good. Okay.
So what is the mission statement of Coastal Hospice?
Providing comfort, holistic care at the end of life, and honoring personal choices. We want to make sure that everybody's taken care of in the way that they want to be taken care of, because they're in charge.
Yes.
What personal choices are there?
You know, it's any choice that a person can make is what will, abide by it. They don't want their blood pressure taken. They don't want to take a medication. Any of those things. People have patient rights and autonomy and can make choices. And we're just there to help them hopefully make better educated choices.
Very nice. How long have you been the CEO?
6 years.
And you were a nurse before that, right?
And still am.
Yeah.
Yes.
Well, yeah. Okay. Well, I guess once a nurse, always a nurse. How do I know those things? Once a driver, always a driver. So if you get in a bad accident, then you don't drive anymore. Now, because there is the intertwining of the person that is transitioning into death and the family usually that surrounds that person, there are the needs of the family. I want to have this done and I want to have that done, but you're saying it's pretty much what the patient wants if they're cognizant and they're...
Absolutely. I mean, family dynamics are extremely difficult sometimes to navigate, but we have a lot of experience doing that. Some patients will allow their family to steer, and that is their choice. If they want to allow that, then we are okay with that. But if patients are asserting themselves, then we will help them do that, even with a difficult family.
Because it's all about them, right? It's about the person that's dying. I'm sorry, guys. Keep your emotions, keep your things in check. You're not that dying person. Let that person make those decisions if they're capable of doing them. I remember you telling me that, and that had a big impact on me.
So do you do something like an advance directive that they're saying beforehand what they actually want done / not want done?
Yes. I mean, we do all kinds of questions in terms of what they want and what they don't want.
Yeah.
We ask about their final wishes, their wishes of their remains, but also what do they want the end to, the last days that they get to live, what do they want those to look like too?
Yeah.
So we ask all of those things. So advanced directives, by the time they've come to hospice, have really kind of they're not as applicable, because those mostly talk about life-sustaining choices, and we're not doing life-sustaining. But
It's
the choices,
comfort.
it is comfort. So it's what does comfort mean to them? Because that is different to people too.
Yeah.
And hospice care does not always end in death. Some people don't die.
Oh, absolutely.
So it
Not
happens.
President
They
Carter,
start-
how long has he been in
Yeah,
hospice?
President Carter's a good example. Former President Carter has been in hospice for a year and a half, or almost 2 years now. And they
yes.
just, of course he gets special.
He does. He is. I'm sure he's getting top-notch care.
Yeah, top-notch care, and he's got 5 bodyguards on him too. So but he keeps, it's not, it's an ongoing thing. That's not going to happen with somebody pretty much in your case, right? You're there. What's the longest time you've ever been with a patient before you said, well, we're not going to?
Wow.
Been months?
More than months. I mean, we've had patients on for years.
Wow.
And we've had patients come on service and then leave and then come back and then leave and then come back,
Right. They can decide at any time
Yes.
that they don't want to be on palliative care or on hospice care anymore. They can go out, get a treatment, then come back.
Yes.
Doctor,
Technically.
explain what palliative care is, please. Or both of you, either one.
Yeah. Comfort care. It's really about receiving comfort and not curative.
That's palliative is comfort care, and then curative is
Treatment, like
Treatment.
medical care.
care.
yeah. Do you the image that I've always had before I found out about hospice was you're just coming in, a bunch of drugs, and shooting up a person, or sedating them with medicine until they're done, because they're done. They're basically at their end of life. That's one of the things that's out there. People think, oh, they just got to come in and drug up grandma until she dies.
Yes. And I don't want to give a false impression that never happens, because there are certain circumstances where that is the impression, because that is kind of what happens. But it is people, their death process can be very unique. But there are people that die comfortably and naturally, but there are people that their body fights it.
Yeah.
And so that's the term terminal agitation. Their body is really fighting it.
Terminal agitation.
And so sometimes the medication that we give will cause them to be unconscious, and that's really the only way that we can get them to be comfortable. That's not ideal, and it's never what we want, but it's not also out of the realm of possibility. So I never try to give people that false impression.
Right. Well, some people, one of the 2 people in my life that went through hospice real close to me, went through it with so much incredible threshold of pain.
Yeah, that was my question. Why do so many people experience so much pain, even if it's not really related to the disease primarily, right?
Yeah, well, I mean, if you can think about the dying process, really your systems are shutting down, and that's not going to feel good. It's, if you can think of like your tissues becoming necrotic and losing blood flow and blood supply and oxygenation, and that's really what's happening. And it's a slow process frequently, and that's painful. That is just
Yikes.
not going to feel great.
Yikes.
And it's one of the things that is so scary about the end, is for people to witness that and not realize that there's things that we could do for that.
Right.
Chi-Chi's brother died suddenly.
Yeah.
At 62. Went out, had dinner, and then came back. Said, "I'm going to go upstairs and rest." And they walked upstairs. He was dead.
Oh, you're Gigi's brother.
No,
My Gigi,
You're- yeah,
my brother.
Yeah, right. Your brother,
Yeah, York. Yeah.
York. And it was so traumatic to the family, the living family. What? He's dead? He was just perfect
Yes.
yesterday and today. But for the dead person, it's actually a good way to
Perfect
go,
way to
right?
go.
You go fast. You're
Yeah.
just done. It's all over. People say, "I want to die in my sleep." Well, that's a sudden death, unless you're lingering. Well, okay, so hospice can care for all this range, right?
Yes, absolutely.
Comes in and does all these incredible things.
And we have a pretty good sized team, and they think that we're just going to come in and give them the medication or give them the pill, the death pill, but we actually come in and have a good sized team, because we want to help everybody through the process. We consider the family and the caregivers and the loved ones part of that patient. And so we really we have social workers and counselors and spiritual counselors
Sure.
because it can really bring up that existential crisis for people that are left.
So how many people does Coastal Hospice and Home Health employ?
We have 40, a staff of 40.
Oh,
And that's everybody from our medical records to people in the field that are, in the front lines, as you will, taking care of people. So, yeah, we have a pretty good
another
team.
interesting thing I've known from our prior talks is that you're always looking for volunteers, right? That we're going to come in, that are
Absolutely.
going to come in and give the care. Are you training these volunteers?
We do train them. They actually get really specialized training. It's online so that they can do it from their home. And it's specialized with the dying process, what to be familiar with, not to be surprised. And it's extensive, and we are looking for volunteers to do anything from, we've actually had them come and just do lawn care at our building, or office work. But they also go to people's home and they could do lawn care for patients, animal care,
Sure.
light housekeeping, reading. Some people want to read the Bible to them.
Sure.
Some people want just a regular book. Some people actually take notes and will write down a person's life story
Oh, wow.
for them. So that's really impactful and what a huge honor.
Yeah.
be
You
able to
mentioned the office here in Brookings. What is the address of that Brookings and where is it?
The
like the-
address is 585 5th Street.
5th Street. So it's up behind the grocery outlet, right?
Exactly, yes.
Right up there, just a couple buildings up. And is it, we're going to stop here in just a few minutes to get a legal break, but legal euthanasia exists in Oregon, does not in California. Are you dealing with the black pill? Did you have...
It does exist in California.
Oh, it does? I'm
Yes,
sorry. Okay,
it
I
does.
stand corrected.
Yes. And it has since, I think they passed that in about 2016.
Oh, I was just testing you. Just making sure you knew this.
Yeah. But there is no like single pill, and we don't do that actually. That comes from a separate doctor, and it has to be certified by 2 doctors, and it comes from a special pharmacy, and there's an organization, a nonprofit called End of Life Choices Oregon, or if you're in California, End of Life Choices California, that will put you in touch with providers who actually will make sure that you can get the service and that you qualify legally, because it's a few hoops to jump through. It's not an
Right.
easy
You
process.
can't just say, I want it because I'm thinking I'm going to go blind.
Yeah,
heard
there's
of people
waiting
that,
periods, and then when it arrives, then that's when we can help. But we don't help with that process. It's not really.
Right. Okay, what is the address here in Brookings again?
585
585?
5th
Street. Okay. What about Crescent City?
786 H Street.
So you're not far down from is it the VFW, right across the
Right
street from the
across the
VFW hall there on 8th Street. Okay, and the two buildings, I know them both. The bigger one, a much bigger one, is here, and that is why. That's your main headquarters, the one here in Brookings, or that's where the medical supplies are also kept?
Both of those, yes.
Okay.
Mm-hmm.
All right, cool. We met you down there. Okay, folks, I'm going to stop right here before we get back to this very interesting conversation we are having in the studio, KCIW studio. You are listening to KCIW, 100.7 FM in Brookings, Oregon. Regardless if you sing, you do have a voice, and that's what we are all about. We love having people join our radio family. Gigi and I did, and we've never looked back. It's a good community of people that care passionately about our lovely coastal village. If you have a penchant for serving, community service, volunteering, think about joining the KCIW radio family and get involved. You can serve, you can contribute, you could donate your time. You could always donate money to an exemplary local nonprofit radio station, no matter how little we can use it to keep up our cost on this end. We are a non-commercial, not-for-profit organization and a radio station. We're here for you. You can find out more by going to kciw.org. Jamie Daugherty, CEO of Coastal
Home Health and
Home
Hospice
and Hospice
is here with us.
she's the CEO. And
Let's go down to the...
is it a 501c3?
It is.
Okay.
Yes.
Not for profit. Good for us. Okay. What do you got, Doc?
Let's go to the nitty-gritty business questions. Who qualifies for hospice?
To qualify, you have to be certified with a terminal illness, which means our hospice medical director reviews your medical record and will certify that your prognosis is 6 months or less.
Okay, Doc, you're still asking a question.
Yeah. So 6 months or less, with or without treatment.
Without treatment.
So you have to stop your treatment.
That's correct.
Not the treatment for the illness. You can still take blood pressure medication. You can still
Yes.
take diabetic medication, asthma inhalers, or whatever. It's for that terminal illness.
Correct,
Right, that
yes.
you stop taking. All right. Your joke.
Okay. Well, who diagnoses terminal illness? Aren't we all terminal? Aren't we? I'm seriously. Aren't we all? We're all terminal.
Yes, nobody gets out of the show.
Nobody gets out, but so it takes usually a principal physician.
Yes, somewhere
Primary.
along your medical journey, you have received a diagnosis, and then it's in your medical record. So
Yeah. So often, what I see, it's a advanced cancer diagnosis or an advanced COPD diagnosis, heart failure. Those are probably the most common one.
yes,
Okay, but how do you know?
Because when you can't run a marathon anymore, or actually go from your kitchen to the bathroom without collapsing.
So that's how you know when someone is transitioning into death. Maybe. they're
No,
just-
that's when I know that it might be going downhill.
And so at that point, you might say, call.
No, I will never offer that. I will discuss. I will never offer it. I will say these are the options. This is what we are facing. I don't treat end-stage heart failure. I don't treat cancer, so it's not my decision to make. We do have the discussions. I do have mostly patients coming to me and saying, hey, what are the options for us?
Wow. Jamie, you've been in the trenches as a hospice worker for many years and now the CEO. What would you say is what's the most common thing that end-of-life patients, hospice patients want? Is there anything that stands out? Is there just...
they want to be comfortable. They want to know that the pain is going to be helped and treated, and not that there won't be more pain coming. Like, I'm in this much pain now.
Yeah.
Is it going to get worse? Are you going to help me with that?
So you're seeing all sorts of individuals, but some real sweet people. I suppose there's some people that have that, what was that one, terminal agitation? They might have some problems there. But you're meeting some really sweet people that are most probably reflective on life and looking at that. Have you ever bonded and had become friends with these people?
Oh, many, many times.
Yeah.
Absolutely. Through my very long nursing career, which is over 20 years. I mean, I've met and bonded with many people that
Countless. And then what's it like having to lose those?
I mean, it's challenging, but it's a part of life. You always have to be aware that and cherish the people, because anybody could be gone.
Right. And I think it's nice to know that you have given the best care you can.
Absolutely.
Yeah. What is the hardest part of your job?
Oh, it's all amazing, but I think trying to help with caregiver burnout is really challenging, because you can't stop caring.
Right.
It's like being on fire, but you can't put the fire out.
Very interesting.
So that's a hard one to help with, because you continue to care, you continue caregiving, you can't just stop, but that's what's causing the problem.
And you're dealing with death. I mean, it's a subject that so many of us run put our head under a pillow and say, and close our ears and say, don't talk to me. I'm not going to listen to this. It's about death. We all have to face it. So you've got a very interesting perspective on that, and you speak very eloquently about it too.
What insurances does Coastal Home Health and Hospice honor?
Really, all of them. We don't turn any away. But the most frequently utilized is Medicare.
Medicare, because that's the older people.
Wait,
who die.
I'm 66, so I qualify.
You're not terminally ill, besides being
Well, mentally.
eye roll.
But it's really not about age. We've had people as young in their 20s.
Yeah.
Boy.
And so it's not about age. It's about, and even the uninsured, we have philanthropic funds because we are a nonprofit. So we will take care of everybody.
So will you actually try to insure the uninsured? Isn't there Oregon
Oregon Health Plan.
Health Plan? Will you get?
We try to get them on that, definitely, but it's not a barrier for us.
Okay, so besides this hospice care, something I'm very fascinated with and something that has helped me tremendously through the hospice network, and that is the psychological support that you've given to me personally. And I've seen it to so many other of those left behind, those of us left behind after that one person in our life that we loved dies, and we are the grieving ones left behind. So you also offer that, and it's called what? Bereavement counseling, or what do you?
Yep, we have bereavement care. Our bereavement program is very passionate about what they do. And we we as much or as little support as they need. It's challenging because we don't offer really whole person care, and that's very strange, but we're very, very focused on bereavement. But when it rains, it pours. And so when somebody is going through that bereavement and
The grief process.
Thank you. They seem to have other problems that they're going through too, and we can only focus on the grief. So we do refer out as well, and our social workers are extremely helpful with that. But there's a lot of legal things that people go through after a spouse has passed, and so bank accounts, and we hopefully have gotten all that squared away beforehand and can help them steer them towards where they need to go for that. But those are challenging things to do and can add to the grief that they're experiencing. It is.
Grief wiped me out. The biggest thing in my life, I think. Really, one of the
We
biggest.
have an amazing grief group that meets twice a month in the building on 5th Street
in Brookings area.
Yes, and that's really an amazing resource for people, because they're really sitting with people who have gone through it before, and they know the steps, and they can help with that emotional support through all of these changes that are happening in their lives.
Right. So we talked about some of the negative and the bummer part of your job. What's the best part of being what you do, and what's the thing that just turns you on? You're dealing with death, and all its consequences for those living and those that have passed. What's the best thing about your job?
I just love helping people. I always have since I've been a nurse and working in the hospital and getting to know people. I love going into people's homes and getting to know them personally on a very personal nature, looking at their belongings and their older photos from their marriages, and getting to see what's important to them and learn about their values and their points of view. That is really, I've met World War I veterans, which is amazing. I've met just so many people that have changed my life.
Wow.
What do you think the percentage is from people who are dying somewhat slowly-ish, so in 6 months, versus the ones that actually get hospice care? How frequent do you actually get to do you see the dying people as in percentage-wise?
So we have measures or metrics that we look at, and one thing we look at is if we were able to have somebody on service longer than 7 days, and that is actually pretty small. So, and it's less than 10%.
Yeah.
Just usually 1 or 2 a month that will come on and they're on service less than 7 days. We like to have at least 7 days because so many of our team can't even get in there and really help with the support and make a relationship and build trust.
Sure. So you're saying get involved with hospice as early as you can.
As early, yes.
As soon as you see any kind of an onset or changes in this individual, get involved, call hospice and get some
just to get the information and everything what is out there.
Right. How to deal with it. So the more you know, the better equipped you can then give advice and provide service for that person and their family.
Yeah, and I wish there was more information out there, and I know there is, but I wish that people knew how to get that information because I have seen people who wanted to know what palliative care is, what hospice is, and what moving into assisted living, blah, 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 all these different options. I feel it would be nice if that information was given to people, every day or every time they go to the doctor's office so they get to know all these options. Because I really feel there's not a lot of people who take advantage.
I agree. Yes, absolutely. There's not enough.
Right.
And they don't have to be afraid about getting information.
Right. Information should be eagerly be wanted. The other thing I feel is you just never think you're the one that is going to die. Yeah. I mean, we always think, okay, everybody else dies, but we're invincible. I know it's not true, but it's other people who are sick and which...
Well, we run in America, at least we run and put our head in the sand. We don't want to hear anything about death. Don't just stop talking, lower the volume or raise the volume. We don't want to hear that. It's not going to happen to us, and yet it does all the time. So again, maybe those are the lucky people that go fast. Boom. They just don't. It just, the door closes instantly, and then it leaves everybody bewildered.
Yeah.
But at the same time, there's a lot of processes you don't have to go through. You've done these processes. You've seen all the matrix working in so many interesting ways. And then again, something that's so important to me was that you offer these bereavement classes where you can actually sit down for an hour or two. It happens twice a month, you said, right?
Yes.
I've been to it. I've been to multiple ones. Really important to meet other people that are going through the same kind of things. You learn a lot from them and dealing with death.
So hospice care is done in people's homes, right? You do not have them in a hospital bed, which is scary for the people caring for the people on hospice, but it is so much nicer for the people who are in hospice, and people who care for the people in hospice get used to it very quickly. It is not as scary as it sounds because hospice comes into your home, explains everything 50,000 times if need be. And I cared for a hospice, my partner, patient, and I know all these medications. I know what to do. And here I was calling at 10 p.m. Please help me. I don't know. What did I do wrong? Because it's so nerve-wracking when you have to do it. But guess what? You get used to it.
Yes. And, it doesn't matter your background. It doesn't matter.
No, it doesn't.
It doesn't matter how much money you have in the bank. It doesn't matter your, how powerful you are, how powerful or famous your friends are. It happens to all of us.
Yeah.
We all end up in that same place.
I don't want to be the richest man in the graveyard. No desire to be the richest man in the graveyard. Darn it. What's your opinion on legal euthanasia? Did we mention that? We talked about
it's
a little bit, yeah. I mean, my opinion is it is very personal choice, and you have to really make sure that you have all the information before you make that choice.
Cool. We are kind of running up into our area where we're going to be quitting this conversation in about 5, 6, 7, 8, 9, 10 minutes. But what are some of the events that's going on? There's a mystery dinner. Tell us about what's going on with these are fundraisers.
Yes, so we have a fundraiser. It's the same event. We're doing it one in Brookings and one in Crescent City. And it's a murder mystery dinner.
You dress up, right?
Yes. You could dress up. It's a Western theme.
Western theme, and where is it held?
So the one in Brookings is November 2nd, and it is going to be at the Chetco Brewery.
All right. Whoa, that's going to be a lot of people, right?
Yes. And so it is a Western theme, so come dressed in your rhinestone cowgirl if you want, and cowboy, and that's November 2nd, and that is on, I think the address for Chetco Brewery, 830 Railroad Street.
If you live here in Brookings, everybody knows where the Chetco Brewery is. A big cavernous place.
Yes,
space.
It is.
So it's put on by a theatrical group?
Yes.
Okay.
Yes, they're coming.
And then the
from
food is
Portland.
being all catered in, or what?
Catered, and you have your choice of prime rib or veggie lasagna. And that's by the bearded chef. So he's a local.
The bearded
see
chef.
him
Wait
at
a minute.
Coastal
The
at the
bald.
parking
He's bald on top, but he's cool. He's a good guy. You see him at the
Yes.
store all the time. Chef.
And then in Crescent City is November 1st. And that is going to be at the Masonic Lodge. And they have a beautiful building, actually.
Where is the Masonic Lodge?
And that is on 259th Street.
Ninth. Okay, I know where
259th
Ninth is. Oh, I know where it is. Yeah.
Yeah.
Okay, that is a nice
So you go
building.
past the Dairy Creamery,
Yes.
and it's down there,
Cool.
closer to the water. And it's lovely. It's a lovely space inside. And
How do people get a hold? How do they find out more?
to get tickets, you can get them online, coastalhhh.org.
HHH.org.
Now, do you know what it stands for?
Yeah.
HHH? Say it.
Homeopathic.
Home
Horrendously.
Health and Hospice.
Oh, yeah, I know that. I was just testing
yeah.
it. CoastalHHH.org. You can find out more about these events that are going on, murder, mystery / whodunit gatherings where lots of people will be and having a good time.
It's
eating
going to
good
be
food.
Western, rhinestone. Don't bring your
So
horse.
wait a minute. What day are those Friday nights? Let's see, November
Crescent City
2nd
is Friday,
then
and then Brookings is Saturday.
Cool.
Nice.
So you can find out more by going to coastalhhh.org. We are talking with Jamie Daugherty here in KCIW studios on this edition of Jacques and Doc. Doc and Jacques.
Jacques, ladies first. Hello.
Sorry. Jamie, where do you see yourself in 2 to 5 years?
Well, I'm going to be here, where I'm going to be doing what I'm doing. I love home health and hospice. I love this area. I moved from Medford, and I actually got a call from a recruiter. I was not looking for a job, and she called and she said, well, I have this amazing opportunity. I said, I'm not interested. I'm happy where I am. And then she said, well, it's in Brookings. And I said, Brookings? I like Brookings. Tell me more. So I love it here. I love this place, and I love what I'm doing. And my personal goal and mission is to make sure that Coastal Home Health and Hospice is sustainable and just is not going anywhere. It will be here for generations to come and will be able to live and thrive and serve this community.
You need to come in and make those PSAs.
Yeah, you should come in every Wednesday. We should remind our listening audience that any Wednesday, if you have a noble cause or group or 501c3 foundation or whatever it might be that's got some good things going on, you could come in any Wednesday around 2 o'clock to the KCIW studios and record public service announcements or PSAs. We have a great staff here. Sound engineers are on hand, and you'll get to meet some of the family, the instrumental people, and the family. We are no longer going to be asking, what do you want to say on your gravestone? We've stopped asking that because we got so many people who just look at us and go, I don't know. And then you asked me last week. And
Yeah.
I said, Ray, I don't know. Out of the blue. So I have no clue when I guess Vern Monet's was the best.
That was the best.
Yeah. What happened? Exclamation mark. For some reason. What happened? I'm suddenly, because it is the people that are left behind that are the wounded walking that are still here, right? And they're not the ones that some oftentimes, and especially if you've gone through a positive hospice experience like we have, then it's all for good. Phone numbers. How do people reach you?
Yeah, shout it out.
541-469-0405. And that'll get you anywhere you want to go in the organization.
So 541, folks, with your pens out, 541-469-0405. Why can't I get a simple one like that?
Yeah. And so that'll get you to California. That'll get you to the medical equipment. That'll get you to tickets,
And
to
what kind
donations.
of medical equipment is there? Is this like standard, everything from walkers to
Yes.
bedside pans
Yes.
and all those kind of things?
We have
Anything?
first aid supplies. We have diabetic supplies. We have braces.
Whatever you might need, huh?
Yes, we have incontinence supplies. We have compression stockings,
The little sponges for the
toothettes. Yes,
Toothettes?
dry mouth.
We have, if you sprain your ankle, we have, those kinds of things.
I need a kind of a brace. No, I don't need.
We have hospital beds.
Hospice. You
Oh,
have
have
hospital
to be.
beds. Very important. Oh
Yeah,
my gosh.
yeah. So we have.
You
all
have
of
to
that.
be, and I can't get a brace for. Okay, well,
And we take insurance,
there we go.
Medicare.
Okay,
and
so
Medicaid.
541-469-0405. Tell us about your Facebook presence, website. What do you got?
Yeah, so we have a Facebook page for Coastal Home Health and Hospice. We have a Facebook page for Coastal Medical Supplies.
Coastal, okay.
Coastal Medical Supplies. And that's a really good one to follow because they put out coupons and deals on there. So that's a good one too, whatever the sales are. you're
End
gonna
of life
find
sale. Oops.
there. Well,
Your joke's coming up, not
Oh, okay. Sorry. End of life. Once in a lifetime sale. Oops.
yeah.
Okay, cool. So on Facebook, it's Coastal Medical Supplies. You can find out a lot more there. And you got this events coming up on November 1st and 2nd. The mystery. Is there a phone number they should call about? The same 541-469-0405? Okay,
Yes.
to find out about that, get involved with that. Okay, I think we are there. I mean, we have once again thoroughly enjoyed our conversation with Jamie Daugherty, the CEO of
Super
the
cool.
hospice in the area in Brookings and
We
in
need more
Crescent
presence of
City.
that.
You are a consummate guest because you're so well versed. You should see her. You're a very lovely woman to look at, and you're totally at ease. You're completely just relaxed.
Well, this is an easy topic for me because I
Yeah.
care so much about
You
it.
care about it, and we know that. And yes, we'll do a double date. You ask, say, hey, Mark. Oops, I must have said, we'll go out one of these nights like we have done in the past. Again, thank you so much, Jamie Daugherty. 541-469-0405. Doc, what do we
Okay.
got?
It's time for
Fun Time Corner.
Corner.
That corner sounds so dumb when you
That
think
was
about
your invention.
well, wait a minute. It was one of the better names I've ever come up with. I came up with Fun Time Corner?
Yeah, you think I ever come up with anything?
Well, don't. You're the quote lady. Start us off with a quote.
All right, you find your
Okay, let me get
funny jokes.
Okay.
All right.
Get ready. Get your pens. Write down these. These are good. Well, I think they are.
The good physician treats the disease. The great physician treats the patient who has the disease.
Now, that is a classic. That's by that Sir William
Dr. Osler.
Dr. Osler, who was back in the 1700s, by the way. That is a good one.
Right?
That is
That's a good one.
Okay. You know how the doctor cured the invisible man. Do you know how the doctors had cured the invisible man? They sent him to the ICU. Hey, who's the coolest person in a hospital?
Who?
A hip consultant. A hip consultant. There we go. Okay, give me another one.
Also called orthopedic. The greatest medicine of all is teaching the people how to not need it.
Yeah. Who wrote that?
Hippocrates,
Wow.
right before the oath.
Wow. That is a classic one. Why do surgeons wear masks,
What?
lady? Well, so no one will recognize them if they make a mistake. Okay, not a good one. I used to think that chiropractors were a joke, but now I stand corrected.
Oh, yes, you do.
All right, what do you got?
3 great physicians are nature, time, and patience.
The 3 great physicians are nature, time,
and
That's a Chinese
patience,
proverb,
as
right?
in CE, not TS.
Give us another one.
Chinese proverbs, yeah. The aim of medicine is to prevent disease and prolong life. That's family medicine right there. Okay. The idea of medicine is to eliminate the need of a physician.
Whoa.
How
Dr.
rude.
William Mayo of the Mayo Clinic.
Yeah.
Right? Like I said, I think I mentioned this one earlier, last year when I went to the doctor complaining I was getting hard of hearing.
Yeah.
Yeah, I haven't heard from him since. Okay, whenever a patient, listen, I'm giving you some tips about Dr. Gigi. Whenever a patient sees Dr. Gigi complaining for a loss of memory, guess what? She charges them in advance. What do you got?
Sometimes the best thing we can do for our patients is to tell them what the best behavior is and then negotiate something they can live with.
I like it. That makes sense to me. I told Dr. Gigi that I had broken my arm in 2 places. She told me to stop going to those 2 places. She's my best. Hey, recently I went to the hospital and the receptionist put one of those little, bracelets on my wrist, and I jokingly said, "Hey, does it come with diamonds and rubies?" And she said, "Nope." But it cost about the same.
Oh, yeah.
A hospital bed is a parked taxi with a meter running.
A hospital bed is a parked taxi with a meter running. Groucho Marx, all right?
Yeah.
Oh, I like that one. Give us another one.
The awe of discovering the human body, the honor of being trusted to give advice, the gratitude for helping someone through a difficult illness. These things never grew old.
Wow, that's beautiful. That's true. The doctor says, "You are very sick." The patient responds, "Well, I need to get another opinion." The doctor replies, "Okay, you're kind of creepy too." You'll never believe who I bumped into yesterday on my way to the eye doctor.
Who?
Absolutely everybody.
Oh, yeah.
All right.
Let me find one. Optimum nutrition is the medicine of tomorrow. Dang. So
That is
true.
good. And who wrote that?
Linus Pauling.
Linus Pauling,
He has
famous
a
Linus
PhD,
Pauling. Optimum nutrition is the medicine of tomorrow.
Yeah.
You'll heed that, if anything. Do you know what I said to the x-ray technician after I accidentally swallowed some coins last week?
What?
I said, "Have you seen any change in me?" Okay. What else?
It is to illness that we must pay heed. To kindness and knowledge we give only a promise. But pain we all obey.
We all obey it. You know what? When pain calls, we obey it right now.
Right.
Everything else we say, I could do that. I'll get to it. I'll get around to it. Yeah. A man walks into Dr. Gigi's office recently and says, "Hey, Doc, I've got a carrot up my nose, a cucumber in my ear, and peanut butter smeared all over my cheeks. What's wrong with me, doctor?" And she looked at him, shrugged, and informed the man that he wasn't eating properly. So,
Okay, one more, then you're done.
one more?
Yeah.
Where do sick boats go to get healthy?
What?
To the dock. Okay.
Okay, enough funny jokes. We're done with the show, and it's the final minute. We have to approach. You have been listening to the Doc and Jacques show on KCIWLP 100.7 FM in Brookings, Oregon. We hope that you have enjoyed the show as much as we have, and we want to thank our repeat guest, Jamie Daugherty with Coastal Hospice.
All right. Thank you, Tom Bozak and Ray Simon in the engineering studio. We appreciate everybody. Peace and love. Talk to you next week.
Thank you.